Now joining a media call at the Steuben County Public Health Department. County Public Health Nurse Darlene Smith will be joined here by Tim Marshall from the Department of Emergency Services. Also, Jack Wheeler, the Steuben County Public Manager, starting out now with Tim Marshall, the Director of Emergency Services in Steuben County.
Tim Marshall, I'm the Emergency Manager for Steuben County. Welcome to this afternoon's press briefing on the COVID-19 situation in Steuben County. Also have with me Jack Wheeler, the County Manager for Steuben County, and Darlene Smith, who is the Public Health Director for Steuben County. And we're going to start off with Darlene to give you an update on our current situation.
Good afternoon. We wanted to spend some time talking to you this afternoon mostly about testing and testing numbers, because there seems to be a fair amount of questions related to that to us. Please know that we always want to provide the most accurate information that we can to you and to the community, and that includes the number of those in quarantine and the number of positive cases that we have. The number in quarantine is going to go up and down every day. People will be ending quarantine at the same time that some others will be put on the quarantine list. So it's a very fluid number that's just going to change constantly. Because of the size of the county, it is hard for us to get an accurate count of the number of tests, as we have healthcare systems from Livingston County all the way to Tompkins County that residents are going to for their testing. We have pretty good information from the hospitals, but we are not receiving good information necessarily from the healthcare offices yet. Tests are being completed all throughout the day and sometimes even at night. We do not always get reports of these test results from private labs in a timely manner. We share all the accurate information that we have with you related to a case investigation. This is kind of a step-by-step process. When a person tests positive, our nurses perform an investigation to see where they have been leading up to and after being tested. New York State Department of Health guidance indicates our investigation must start from the date of symptom onset. We can only give the information that is not HIPAA protected that comes out of the investigation. We certainly understand that it can be frustrating not to have clear answers in all the information, but unfortunately we are not always going to be able to pinpoint where and how a person may have gotten exposed to COVID-19. But we can share their known activity as they self-report it and share it with us. Please believe the information that we share is based on our investigation. We can only go off of what they tell us. If they say that they stayed home on a certain date, that's the information that we have to share. We know people lived their lives and were social prior to the social distancing practices mandated by Governor Cuomo on March 16th, which closed bars and restaurants and limited groups to less than 50. Since then, more social distancing and stay-home practices have been put in place. We are seeing test results coming back from many days ago now. When anyone goes in or testing, they are put on precautionary quarantine and told to stay home by the healthcare provider. I just want to remind you that we are a small public health department and have limited nursing capacity. We are urging residents to please not call in the middle of the night for testing questions. If someone has a true emergency, they should call the ER before going there. Current calls received by public health have not necessarily been emergencies, especially in the middle of the night. All residents are urged to stay home, stay safe, and limit social contact. We will see increasing cases as test results from before social distancing regulations come in. The more people limit their contacts now, the quicker we will see the slowing of the spread of COVID-19 in our community. Does anyone have any questions?
I do. Ariel Tuck from 18 News. I know that you said that the numbers of people going in quarantine are up and down. Do we have a rough estimate of how many those are?
Yes, you can. Today it's hovering right around 65 at last count.
And tested?
That's a very difficult number. We we feel like there's been somewheres around 27 tested, but we are not positive of that.
Okay, thank you.
So again, the question with testing goes back to hospital-based testing versus private practitioner testing. So when we say 27, that's what we have basically reported from our hospital providers, and that's not from general practitioners. So if, we probably doubled that when we look at practitioners that have done testing, as well as adding additional testing for hospitals or providers that are outside of our county that are testing residents from Steuben.
And I would say, this is Jack Wheeler, I would say the process for the hospitals have been doing an excellent job. So, certainly the providers have as well. But I think the reporting is getting better as we get into late last week, early this week in terms of the reporting of the numbers. So I think the process is getting better, but it's tough, like some of the other counties that own their own hospitals or their own labs where they can provide you real-time accurate counts. We do not in Steuben County. So we have so many different providers in the field. We rely upon the data that is given to us. And we're doing, I think, a better job collecting that. But the number of outstanding tests is still a little nebulous. But that's not the most vital number at this point. We know when tests come back, and that's what triggers public health activities in terms of active quarantine and monitoring individuals.
Brian O'Neill, WLEA Hornell.
Hey, go ahead, Brian.
Thank you. It seems that when we hear about a COVID-19 patient in Steuben County, they're isolated in a home setting situation. Is it the state's policy or a county policy to keep COVID-19 patients out of the hospital if that's possible?
The guidance is for when a individual tests positive and if they need to be in mandatory quarantine. If they don't need hospital admission, then they don't need hospital admission and they can stay in their home. However, we do go out and assess the home to make sure that it's appropriate for home isolation and that they have can have separate quarters and separate everything for the most part, from the rest of the household.
And the public health nurses also follow up with these individuals under quarantine daily, sometimes via electronic means, many times via electronic means, but they are in constant contact to make sure the individuals are stable, what their symptoms are, how they're doing. So they are doing status checks every day for individuals that we place under quarantine.
Thank you.
Ariel here from 18 News. Oh, sorry.
Go ahead, Ariel.
Okay.
Okay. Thank you. Last time we spoke, I think it was the first, in this similar setting, it was the first two patients that came up positive. We were able to find out that one of the people had been to an event at a Bath firehouse and also went to a nursing home. The other patient, the investigation was still ongoing about where they may or may have not gone. Now that we're up to 5, how far have we gotten into the investigations, and where are some other locations that may have been more heavily populated that they had gone to?
Do you mean, are you asking were there other locations for those first 2 other than what we've already reported?
First 2 and the all 5 now.
So we have released all information related to all 5 cases in terms of what we know so far. We're pretty in-depth on it. I think it's pretty complete and succinct at this point. I don't believe any new information is going to come out related to the first 2 positives, and for that matter, I'm not sure that any new information is going to come out related to maybe for number 5, because that investigation is not as complete as 1 through 4. But we have released any known exposures that potential exposures that these 5 cases have the places that they have been.
And Ariel, if we learn more information, that would certainly be released to the public via press release or some other mean. So if new information did come about, we would do that in a timely manner. But like Darlene said, we have released all known information at this point.
Great. Thank you.
Okay, somebody else had a question after Ariel.
Hi. This is Lucas Day with Finger Lakes News Radio. Darlene, a question for you regarding the third patient that was confirmed over the weekend. There was some confusion, at least on social media, in terms of this individual was labeled as a resident of Corning, but is currently residing in Penn Yan. Can you go into that a little bit more in terms of clarification? Are they a resident of Penn Yan or a resident of the city of Corning?
They are a resident of the city of Corning, but upon finding out the results of their testing, they went to Penn Yan to stay, where they have stayed previously on numerous occasions. So we have partnered with Yates County to continue to investigate this case, as well as providing the daily active monitoring. Yates County has been a great partner in this.
Okay, thank you very much, and keep up the great work and the information. We appreciate it.
Thank you very much. We appreciate that.
Thank you.
Next question.
I'll go again if that's okay. Ariel. What does the county need at this point? I know there's several different agencies calling for people who may have retired to come and help, and I'm wondering if the county needs what they need.
So, we're fortunate to have a great staff here at the EEOC and out in the field. I think for county-specific operations, we're in good shape. The public health staff, Darlene, has a good number of volunteers that she can tap. So for us, I think we're in pretty good shape. What we all need, and what you've heard or will hear from hospitals, and we work on it every day here at the EEOC locally, is supplies. We are in a stable state, I would say, right now. Our local healthcare providers are okay for right now in terms of their supplies. But, every community throughout New York State, every community throughout the nation is really pressed in terms of ordering supplies. We've had orders on the books for 10 days up to 2 weeks for personal protective equipment for hospitals. And a lot of, obviously, those supplies are following where the needs are, and a lot of the need right now in terms of cases is downstate. So we're lucky that some things are trickling into our providers. But to directly answer your question, I believe the county's in pretty good shape for county government organization right now. But, we continually actively monitor the supply needs of our local providers.
Thank you.
Any other questions?
Yeah, this is Jeff Murray from the Star Gazette. Last week, in Chemung County Executive Chris Moss said that they had gotten some complaints from people that some businesses like restaurants and bars were not complying with the governor's order about in-house dining and things like that. Have you had any complaints like that from around any businesses or restaurants around Steuben County?
So restaurants, no. There were a couple issues that came up last week when the orders first went into effect that the localities were able to take care of through code enforcement and others. I know residents, we've been fielding a number of calls and messages today regarding the new essential versus non-essential businesses, the governor's order that went into in effect at 8 p.m. You can find information on our social media pages about who to contact for that. It's Empire State Development at the state level that makes the decision whether a business is essential or non-essential. So that's who residents should contact if they have any questions about non-essential or essential businesses. But to your point, Jeff, we haven't received complaints about restaurants or small businesses or the like.
Okay. All right. Thank you.
Brian O'Neill, WLEA again.
Go ahead, Brian.
Thank you. A lot of people have said to me, how do I know if I have it? Because a lot of the symptoms of the COVID-19 could be similar to other things. Would the respiratory issues, the breathing issues be the biggest thing to look out for, or how does that work?
So the three main primary symptoms of COVID-19 are fever, shortness of breath, and coughing. So if an individual has one or more of those symptoms and is concerned about their health, or maybe they know they've been around somebody who has tested positive for COVID-19, we continue to recommend that they call their provider first and let them know that they're experiencing symptoms, and then go from there. The provider will decide from there.
Thanks.
You're welcome. Anyone else? Okay. Appreciate your willingness to listen in today and share the information that we have. And we'll continue to keep open guidelines with you and keep you informed on where we're at with Steuben County. And again, if you have any questions, feel free to give us a call and work with us as we go through this ongoing international emergency.
And that was Tim Marshall there finishing things up at the press conference this afternoon from Bath. That was most of who we heard there was Darlene Smith, the Steuben County Public Health Director. And what Darlene Smith says is the number of quarantined individuals in Steuben County is changing constantly. A few people will go through the quarantine and they'll get out of being in a quarantine situation, and others will join it. So that number is constantly in flux. Darlene Smith also said that the county has been getting good information from hospitals. Some of the doctors' offices not as fast about informing the Steuben County Department of Public Health about COVID-19 cases. Steuben County Manager Jack Wheeler says, as the process goes on, it seems to get better. Darlene Smith, the public health nurse, stressed the importance of social distancing and said, if you have a medical emergency, please call the emergency room first. And the intent there seemed to be cutting down on middle of the night calls that they're getting at the county public health nurse phone number. And finally, our last question there was, what are the COVID-19 symptoms again? Because, some people feel that there are symptoms that COVID-19 shares with other illnesses. And the county public health nurse, Darlene Smith, said fever, shortness of breath, and coughing are the big three symptoms. And just being around a COVID-19 patient would be enough to get yourself tested by your local medical provider. It's AM 1480 WLEA Hornell. Now back to the Sean Hannity Show.